Maxon Kelly. It's coming with some controversy. Students will now go to school in person Monday through Thursday and then be fully online on Friday. Today, there has already been a change.org petition started to try to get that hybrid schedule back. But when they first came up with the hybrid schedule, there was a petition and outrage back then wanting to be fully online. Each school district, parent, and teacher is having to navigate COVID-19 and what that means for education.
Going back to school is a huge problem. It's complicated.
Since March, schools have opened, closed, gone online, hybrid, full-time, you name it. One school has probably done it. Now the Davis School District is changing their schedule again.
And I also think that going back to a full-time schedule, they're going to end up with a lot more quarantines, and I think they're going to end up shutting down a lot of classes.
I think it's a good idea. I'm seeing the emotional toll that it's doing to my fifth grader.
Happy or not about the decisions, many are wondering why, especially with the statewide COVID-19 cases on the rise. But the Davis County Health Director says not in his county.
For the last, maybe four weeks now, it's been stable. So we haven't seen big increases or big decreases.
Then you have to look at the numbers. Let's take the three largest school districts. Since the start of the school year, Davis schools have only had 93 cases. Granite School District has had 99, and the Alpine School District has had 75, just this week alone.
And as we started looking at numbers in other districts, we saw that the spread isn't necessarily occurring in the schools.
Dr. Jay Jacobson says the ideal situation would be low infection rates and high compliance in schools.
Everyone is at risk of infection, but not everyone gets infection, and the risk is not equal.
So Dr. Jacobson says people can't just look at the kids.
The children who are going are not likely to become very ill or to die.
It's about who they live with, who else they will come into contact with. That should have people thinking.
And this disease has a rate of mortality that is in the range of perhaps 1 to 5%. It doesn't sound so high, but influenza has a rate of about 0.1%.
As everyone navigates education in a pandemic, Dr. Jacobson suggests making decisions with facts, not fear, because knowledge is power. Dr. Jacobson suggests to every parent who has a student that is going to school in person, talk to their doctor, not just about the risks for their student, but for everybody in their household in case their student were to bring COVID-19 back home with them. Live in Farmington, Sydney Glenn, Fox 13 News, Utah.